tall, handsome, from a respectable family. He must have a maid because at our home we do not work.
Conductor Masao.
Why? Overdolo byokusimu.
Yamunange anti yo TV enkolera.
Nyumiro omulembo omupya ogujjudde ebisanyusa omuli emikutu gya TV egisukka mu 8 n'egya radio nga kwotadde ne zifirimu ng'osinziirira wonna w'oli. Genda mu App Store oteeke app ya TV channels ku simu.
Stay entertained.
Wow. Good morning everyone, wherever you are. Mulio muto kona, vyone mkukora. Tuwasima hawikiro cha hati, kani tusima mkama habukutulinda. Nenyu habukubalinda hambere mulio kani hile mulikurungi. Kablikiro mhereza wanyu wanisere TRINAH. And today I'm not alone in the studio. I'm with my guest, Dr. Frederick. I think last week mukasangwa murozereho abantu batuwanshinga. So today we are back tugarukire kubegesaho no kubasobolaho bikebike musemede kumanya. So lakabanze abaramchiyo nikotoyongera.
Muraira mutinyo n'abakusorora heroko. Mwebale mukuteka hingaro. Nsima mukama wabalinzire kukakero kinu. Amabara gange niyo Mutegeki Frederick Innocent adieri ndumuseja mugweri ke wakugambera. Ndumusawa abantu kya katano twalitubalize ebintu ebimwe bikwata obumezi kya bakirumi ngutongere tugaruke kya katano kintu bibaze.
Okay. Dr. Obala kuyiza nimanya ibejeri batwegesezeho bicyatuli mu matukane tucyabijuka. So tukamalira actually na topic ya high blood pressure ngereke yasemeye controlling amonerete bwaki niho tukujya kutandikira aho tugimalire. Then we again talk about UTIs nimanya abantu abalioku ni halo abakumanya alo na batakumanya bitumusa wetu aiza kubitusobora kurungi tubiyetegereze. So wait doctor, I think so watandika program na high blood pressure.
Abale munaboli ntakatandikire ningoza kongera kusima for TV habo mugisa gumu ugo kuyamba ku disseminating health information on bantu. Information is power. Nayo aboli ngoza kusima okutuza costing a program when wiro wa hoireho tukabaza blood pressure. Pressure yesagama kuba higuru mu bigufu. Twabazaho nko kwera kuija wali tuned paka bakakijuka
mpaka
bakijuka. Baitu blood pressure no kakuba tongera ku reviewinga okataite nyuma ntujuka ntugamba ngutiza silent killer obwiro kerate kuleta symptoms. Baitu symptoms zinu kakubaza bazizire na haba mu symptoms iki. Obwiro bukukira essential hypertension nayo twalitugibalizeho obwiro kumalira ngo haro essential hypertension. Hypertension kuija ali abantu abala above 30 years ngera no kijuka ntukibazaho. Obwiro bukera kakuba blood pressure no eba haiguru muno haro signs obwiro bukira signs nzibastaro baitu haro signs zo kurora ukamaya nsobora kubandoira pressure sene yo kubanza muno kutera umutu headache ina types aro umutu gukutera maiso hanu baitu haro to describing a headache by nature aro headache throbbing omuntu ngukutera no sana kawali ombatera mwengoma mutu gwao throbbing headache kurebi yamba so headaches zinazo zina types aro inflammatory headache aro throbbing headache ege okura nature ya headache omuntu ngukutera no hurebi yamba gamba mutu then aro type yo mutu ngukutera no hinduro mutu kunu nugujya kunu no hinduro mutu kunu nugujya kunu no hinduro mutu kunu nugujya kunu that is always an inflammatory headache. So hypertension obwiro bukera kakuba pressure yawe bere iguru muno o taina burwero bundi let's say ka malaria hati okuba na malaria omuto guno ni gukutera in a way of inflammation abokube binywa byawo mbiba babukire obano yitegereza so omuto ngukutera in that format ngobo kwehinduroti omuto ngya kuno kwehinduroti omuto ngya kuno but most times hypertensive headaches ziri throbbing omuto ngukutera then nozgora obuliao no uraka izgolezo obwiro bukukira haija no kuuma mukanwa
no kuyake
mukanwa so bunu nubo signs obutaito sobora kujaho baitu no sobora kukura no mutima ngukutera omanyiro bokubo ikalire like this, you are not supposed to be aware of mutima ngukutera, you are not supposed to be aware of your heartbeat to sameri kura mutima gwa for instance azini ikalire mutima kinguhura but the moment you sit ukahuru mutima gulio ngora eso medical into zeta palpitations ekyo nayo never saying pressure yawe sobora kuba iguru so nikiwanje tagiso iruke wango ohikahirwaro wanze wakuchekinge blood pressure yawe arona tests ezindi squeezera mu tuja kuzibaza mbwire bo maisaho baitu ekiri very vital ngu blood pressure wiro kerate takuleta symptoms eri asymptomatic so owiro we kuletera symptoms kandi ebintu mbiba bisobere so it is always necessary ngu obokubola haiguru yemyaka 30 no ugende ruguru you are always liable to having this hypertension ogende bakuchecking so au nikija kutuleta discussion ya risk factors risk factors muntu kyo wala risk yo kufuna hypertension watuliza heroku who is that person who has the highest risk of having an elevated blood pressure. One is people who are obese.
Awanda wanyesera mwana.
Wabale kuchitegereza. Naam, iyo tonyese. Owiro ukira kakuba BMI biomass index yawe eba haiguru muno. Kyakubaira kirungi kakuba abantu babamanyeta kuno hasi amabunu na amaguru nebindi. But to the moment you have trunk obesity, trunk and myself chweke kutandikira kugarukira guru. No funa a lot of fat coating around your body organs in the viscera. So if such a been here yonka niveleta inflammation. But to here yonka obesity predisposes you to having hypertension. Not only hypertension but blood pressure. Obwiro bukiro boku wene pressure haiguru muno. No kera muno no kutunga sukali aboko
maisa sukali nanga negena na sukali pressure
they are twins barongo but to the only logic yeroho pressure we kuba haiguru obwiro bukera ne sise binywa ne sisa pancreas hati pancreas and adrenal glands okuno ba secretingira hormones is kubalancing sugar zao so kakuba hormones zinu by any chance pressure ba igumune ka damaging the adrenal system so you are likely to also get diabetes type 2 ekyo diabetes topic yekero kindi ntwenda kubazaho pressure baitu risk factor yo kubanza itwabazaho is omuntu kugira nkoku yanyeta muneki ngurende
kandi utanyoka nimba n'abantu batanyesera nakade tayilo banakanyamba bara pressure
nakyo tujja kibazaho baitu kugamangu risk factor nkamaisa omuntu wonu al more likely kuligama ngo abanyesere bona mbafuna pressure nango tugali mazima baitu omuntu ogwali more likely kufuna pressure wakubali obese and most times trunk obesity obesity ebichweka biruguru aho you are more likely kufuna high blood pressure
hati obesity katugambe eyokuleterezwa like kugamba munoli ebisajja bingi rundi just kugamba nobora bonyesere mubiri gwawe alo kusanga ni kwani ahali naturally tibina bisajja bikwali
obesity ni kibanka mainsa of course to in a medical terms is to causes ngabia mai ebitu nsobora kutabigia muno baito obwiro bukera kaste level y'ebisajja bya rundi kunyeta kuhingura ni ruguru we term that as obesity so obesity predisposes you to abakuba tosobora kubobesa utine excessive fat utakwetaga omubiri gwine mechanism yokwahora ebyokulya ebiri excess when you eat food ebyokulya byone ebitukulya it is converted to glucose and glucose ni your form yomubiri recognizing causes glucose is the active form of energy in the body so when food is converted to glucose, the body has demands. Demands of a specific exactly. It has demands of a certain level of glucose that it needs to function. So a level of glucose, of course, due to dietary intake, olire bingi kusigikira umubiri gwawe kwenda. Hati umubiri gulifane ngo ibindi bintu ngubyahura nukubyahura somewhere so hati first deposit site niyo adipose tissue so nugwahura yuko but remember even tomorrow you'll eat excess more than you need umubiri ngo yakataitu ngutwara so body demands are less than dietary intake no muno kera not gamangunuli a lot of food but you are eating a lot of let's say nutrients that the body does not need but it suspects that maybe in future you will need inkokukarabuli abatoro bayezaga muno bayahurage byokulya mumbuli such that they preparing like so no mubiri nago niko gukora but you keep adding so it means stores nizijura na handi hati omubiri ngongera ngusera mechanism zindi kwa urambinywa byawe kuteka habichweka byao byo mubiri exactly so ekyo ukikubaho obwiro bukera fat zinu omubiri ngukora muno to distribute blood around I mean the heart to distribute blood around these organs. So that is why obesity here ne predisposing amuno to hypertension. Not naturally gamangoli al fat as long as you're fat. Ekiakabiri risk factor ya kabiri is alcohol intake. Amaru. Amaru kuganywa may not be bad but to excessive intake of alcohol. So amaru ugakuba maingi muno. It predisposes you are at the risk. Kulugango bona wanyura amaro bina
magama nugo sara pressure.
Naam. Ago tugal
mazu. Yozo bayambura mkyaro kumbagama ngo amara ngasara pressure ngasara sukari. So abantu atoka kufura mbazi.
Nango. Amaro ugakuba maingi muno niga kuteka ha risk yo kurwara pressure. Terina pressure yonga biroire bingi muno. Kuja very related na alcohol weto ikirwire kya manu muno kikuja mu liver disease abo kube kine kyao nikyo kine responsibility yo kuyamo obuto abuno ko ahurumu so kino okikukora muno nikika nakyo nikikora kijwa so alcohol intake ne predisposing muno kufuna hypertension. Ekindi risk factor common muno predisposing omuntu a high blood pressure kandi common muno biro is sedentary lifestyle. Sedentary lifestyle nkimanyisi iwe to yokwataho no imuka nchakara no genda haduka no mduka harumu mukozi so mukozi ni wakwihira ebintu your work is to receive money, but remember ulirege breakfast like exactly you probably took like 3 eggs. So omubiri kakuba gutaba active. Nikimanyisa iwe body energy demands zawe entaito. So iyo omubiri energy to gikozesa muno. Yes and no, but most times nikimanyisa ngu ebyokuli ambeba bitaine mugaso gwa mano gubikora. Kandi ati wikaliri. You have woken up in the morning, toine chokozere kindi. You have sat down. That is called sedentary lifestyle. Kale no kwikara is okay, but even in the evening bokubano inuka no tamuka no yoga no byama. Ego lifestyle terenungi. And that is why once in a while mpaka no taga ugendo irukemu. Exactly. So blood pressure no wekuberi more sedentary to kwenda kwataho. That is where you even become obese from. But most times you are always predisposed to having hypertension. Because you have a predisposing factor which is being more sedentary.
Then hawaki abantu pressure wengi nosanga azingire binyo bitukira here. Most of them are high blood pressure. Nosanga ne binyo bizingire bitukira here.
Hati owiro bukira kisobora kutaba nombarwere pressure buka. That is very deep physiology, but to event to quite atherosclerosis, natural omubiri obukubano kugenda maiso obukubano okura have acute inflammation mu vessels zao ebinywa byawe ne developinga hati mu rutoro nkisoborenta but nabaho series events kubaho then habaho coatings mu binywa byabo. Science that is atherosclerosis, plaque formation inside the blood vessels. But tumurutoro nikimanyisa kale binywa byawe nibikea na habayo growth munda vessel lamen yawe werawa yalningana hanu nekea ningana aho. You get abokuba na habayo growth because of atherosclerosis, you know, atherosclerosis, plaque formation mundoku. So zeno plaque formation obwiro bukukera is blocking a blood supply. No sanga mbere sagama yarabaga freely, this time we kuija newanza kufloodinga, and that is always very bad. Blood stasis esagama nija newanza kuba stagnant. Egyo stasis esagama yona kakubeye mera for some time ne clotting. That is why you hear ngole afunireki clot. Exactly. Egyo, it is very deep physiology. We may not go through it for the good of our viewers, but itungu deep vein thrombosis nkokuwa gamba. Murutoro ruli simple. Ebinywa byawe nhabaye kublockinga. Kiri natural. Nikija haba acute inflammation mu vessel yawe, vessel diameter yawe nekea. So ebinywa nebibe engorged, nibija outwards, and most times niki happening mu veins. Buli tukagamba ngo arteries nizo zikuye sagama mutima, zikagireta mubiri gwawe, zikagisupplyinga ine oxygen, ine nutrients, then veins nizo zikuja zikapikinga blood eno zikajigara mutima. so esagama yo mu veins neba negenda mpora ebinywa bya veins karabuli otwabaga nsoma mu science bagambaga all veins carry deoxygenated blood apart from pulmonary vein. At pulmonary vein ekinywe kya pulmonary vein ekyo nicyo kikuhesagama mbeha kikagigara mutima wiro bukeranke bakina a lot of oxygen. Then all arteries carry oxygenated blood rich with nutrients at high pressure moving very fast except the pulmonary artery. Okay, so ego science ego sobora kubeta necessary in this discussion it helps you understand habwake binywa byawe ni bizimba. Deep vein thrombosis most times ni kibaho because of blood stasis. In fact abantu bano kubantu bajanja abantu baherezo mubazi emibazi ya blood thinner emibazi yo kutanga sagama yo clottinga. So deep vein thrombosis nayo predisposing factor.
So hati hiyo kwa musango magaziki ya musanga abantu ndete tuneyo bantu betu bali pressure then nabandi abali ahiro kuba wachini ngereke yo sobora kuhandlinga mu muntu wa pressure habo kuba musanga kantu kataito kati weka kamya mara musango mutema yabakubi so abantu abengi twakuba manyenge yo kuba kwatamu nebike basemeri kuba hangwali ikintu rundi akosekera
ekyo kubanza no kubanza risk factors nsobora kubatazimazire yo nyingi muno sobora kubatazikozesezo tutazibalizeho zona kwayo baitu risk factor inkwenda kubazaho muno risk factor ya umuroiro wa kurwara kidneys muntu wa kurwara ensigo wiro bukera kakuba no rwara ensigo it is always obvious gupaka no ja kurwara pressure abo kuba buli obutwali ntubazao pathophysiology rundi nko pressure kuija tukagamba most of the times kidneys nizo ziha amazing musagama yawe in form of urine so kakuba by any chance amazing gano musagama gatarugamo for any reason so nkibankimanyisa hati blood volume neba nyingi so no rwara pressure so anything that predisposes your kidneys it makes you have a risk factor for but of course even age tagama wantu bakurtu abachwero musango baitu omuntu wa kukura no mubiri nango nukora so old age is a risk factor of hypertension. Even you, when you grow old, we shall always have you are not going to get, but you will always be on risk. No, anytime in the hospital, when you're saying Uganda, you regard all women above 15 years as pregnant until proven otherwise. Until you do HCG. So similarly, in the hospital, you have to consider all people above 35 years or 50 as hypertensive until you have checked their blood pressure. So blood pressure, of course, in a complications. But to takagira complications, ekikaguzo kyawe ekyokaguize. Blood pressure enu twage avoidinga tuta.
Yes, no muntu oguswa kumisaki ururwe.
Obwakubagini. Haro preventative measures ezogamba ngunyoti nkwenda gitunga. Haro na preventative measures ezogamba nyo already blood pressure ngine but I want it to stay within manageable ranges. Abokuwa we orukwikarira haiguru muno ne sisa kokutwagambira. So ekyo kubanza muno is dietary regulation. Dietary modification. Especially with essential hypertension. Ebyokulya bisemerire kuba limited, especially salt intake, ekisura. Omuntu bakwanarwara pressure wiro bukero bakuja mwirwara bakaikuru ntubagamba wewe aka pressure ako ekisura mukako keshieho because salt has sodium. So ekisura ukikuba kingi musagama nikisika amazing. So muntu nafuna high blood volume. So pressure ni yongera. So most times we regulate their salt intake and sugar because these are solutes. egyo nayo physiology deep ya Starling's forces of what ebe tusohora kutabigyamo baitu sugar and salt regulation, modification of sugar and salt intake. We also always advise these people ato bako bananywa muna amaru. We always tell bana abantu abakuwara pressure wewe amaru agokoleki exactly. Baitu harone emibazi ende itu kozesa iyo ku increasing pressure. For instance, men who use sildenafil, you gimanyine ka Viagra. Those medications, they are also a risk factor to have high blood pressure. So we kira emibazi steroids. These people who use steroids to gain a lot of muscle and become huge. Those people who go to gym, bodybuilding, they predispose you to high blood pressure. Abokuba most steroids alter your adrenal system. So owiro bukira nikiba kibi kwikara nokosa steroids zezo kandola in a blood pressure. So medication, drug intake. Super appetite yegyo nsobora kubantagina background nungi abokuba nkisana it is a herbal drug. Owiro kera herbal drugs zine good documentation. So sobora kutamaya side effects to sobora kumanya mode of action.
Actually it is not a herbal drug. Butuma wabikira kamuno wa Kongo. Boga Kongo so abantu bakosa muno bamyete bamera musangola nyetire kyomwale nokule. Amezero duma kapakitina gama kaikumi. Ituka buli kasake kapakitin kaizira mu 10 tabs. 20. So aho nimba ninkubia akakuba mugambera ngimonyiri abokuba personality na documentation kumara ha super appetite maybe obunaruganda njagena nkiserulize. It's not common.
It is not common. That is very true. So medications also predispose you. So we don't kiro mtu wako wa pressure, we limit the type of drugs they take. So most of the drugs omubazi gwono gukumera kakuba gwa gutaina mugaso gukora mu mubiri, then it becomes poison. Unnecessary steroid intake, you take analgesics. You get it is also not good when you are hypertensive. So a risk factor, and of course, alcohol intake. We always tell these people, please, you regulate the levels of alcohol and cigarette smoking. Atuine kintu tukweta pulmonary hypertension, co-pulmonal, blood pressure ne originating akurugambe habiyawo. Because you have pulmonary congestion, ukabi smoking amwetaba. So wiro bukira ekinywa kyawe kya pulmonary vein ekikuiha esagama kujigara mutima nikifune kizibu. Sobora kutagena physiology yakyo. Your blood pressure ne originating ambeha. So it is very true ngo muntu wakuba nanyo munetaba muno. Nanywa shisha. Now these days we have a very funny generation. You find a young beautiful girl smoking herself mad. And this which is not true. Which is not true. Of course, we always give excuse to our stupidity. Because you cannot tell me you are smoking and you are saying this is not smoking. It doesn't make sense. So those shishas you people take, they predispose you to a lot of problems. But in this regard, for today's topic, it predisposes you to hypertension. If you have hypertension, then we will stop you from having shisha, because when you take it, it will increase hypertension. Okay. How? Because most times when you take this smoke, it causes pulmonary pulmonary pressure yao ni originating mbeha negenda mutima. Most times no sanga mutima gwaluguli kurungi, but because of the lungs then you have developed high blood pressure. Ro nebindi ebikujam COPD, chronic obstructive pulmonary disease. Biona ni bijam, but in this case we are talking about high blood pressure only.
So Dr. ati sawa Kristo tubalizeho na muntu wali aheru oku kutusobora ibyo kuliyaki ibyo sobora kulindisa omuntu wa pressure kurorangu wa mensabune ibyo kulya tibya mutalibaneza habwe then kwe at least na topic
dietary intake ni ndio mbele ndio ni ya kujao. We always advise these people to take a lot of water. You know water is life.
Ikero kimna nyandita zinga
osobora kuta recommending a liter baitunkisigikira. That is why kiba kirungi muno ekintu nabana yebwa omurwaire wa pressure kuroraga omusaho every after a time agreed upon by a physician for daily reviews. Abokuba bulikiro na hijamo ekintu kishaka. It is not good muntu weto wali aheru abamazire kuhandikira obujuma bwabo wa pressure bakakuha return date yo garuka mwirwaro hanyuma yo kwezi kumu iyo kataha then obujuma buno ukabata nugena no gura ekyo nikiba kibi muno. It is always very bad. So nicho chikungara akikaguzo kyawe cha ekebe okuli obwiro bukera abarwero bakujja nibo tubantu bakaguza bino mukaikuru mugurusi omubazi ogumizire kurungi adherence. You know emibazi ya pressure nutikiwa kirungi obokugitandikire kugereka abokuba it is nephroprotective, it is cardiac protective. Most of these drugs cushion your organs from damage by blood pressure. In other words, emibazi yenu ni amba functionality yebichweka byawe bindi. So wiro bukiro kugereka you expose your organs to damage.
stroke.
If you are stroke tuja kubibaza complications of high blood pressure. So dietary intake wiro bukira we tell these patients to stop taking a lot of salt. Ekitubere tukibalizeo take a lot of dietary water. Then roughages on their meals. Wiro bukira we advise patients to take food with high fiber content. Ebyokuli ebirumu vegetables, katugambe vegetables, dodo, cabbage, carrots, enswiga, cucumber, those ones. Hizo, they make you satisfied, but they have a low calorie. Zine energy entities kuleta mubiri, but when you eat you become very satisfied. No sana nko muntu walide ebyokuli. But in other words, you have not taken in a lot of food. And they cause good bowel habits. Bowel habits in kimaisangu, you will not have constipation. Very good. We always tell these people avoiding exactly. Actually ngino mkwekuruwanga uwe nkamugambire nyama yao atengo exactly. Nyama gitalike such that you remove yala cholesterol, too much cholesterol. Cooking oil you could be a lot of cholesterol. I think you know topic yendi high density and low density lipoproteins. Those ones they also predispose you to increased blood pressure that is not controlled. But most importantly, abarwere bantu advising akumira omubazi gwabo kurungi. When you start skipping drugs, then you cause yourself problems. We always advise them to have enough rest, but we always caution them against being sedative. Kwikaro ikaliri. Exactly. Rwajorora hika distance intaito yo kuruga hanu kwika mtauni ruguru no rubataho. Exactly. Otsobora kutagambo iruke. Exercise it is always very good. That is why abantu beira hibwe bintu community byabafikitingaga exactly because they were always very active.
Okay. So thank you so much for kuno gendo rokorangu omanyira tsazo bantu beinga babire pressure Baingi no sanga no misiki nsinganto nkaitwe awire pressure.
Baitu takimanyira gwagirwe.
Yeah. So like atwa tugenda mbranga bakama baitu nkutugaruka n'ikicaka cyetu cya kabiri.
Fort TV. Stay entertained.
Hello viewers, I'm TRINAH, your host of Free Talk program. Ebayo from Monday to Friday. Kutandika saha ina mpaka saa 5 nikitweka. Thank you so much. Stay entertained.
Fort TV. Stay entertained.
He must be rich, tall, handsome, from a... He must have a maid because at our home we do not work.
Conductor Masao.
Owa, obadde olobye ku ssimu?
Yamunange, anti yo TV enkolera.
Nyumirwa omulembe omupya ogujjudde ebisanyusa omuli emikutu gya TV egisukka mu 8 n'egya radio nga kwotadde ne zifirimu ng'osinziirira wonna w'oli. Genda mu App Store oteeke app ya UTV channels ku ssimu.
Fort TV. Stay entertained.
So mwebale mburango abakama baitu kamanze nsomeho messages abantu baitu batusindikira hano. Rita Hugs yagamba, but doctor, these people, are they not supposed to eat vegetables?
Timanyere whether that comes in form of a question, but to vegetables nkokutubalize hoga is the most recommended diet in bantu abakurwara pressure. Abokuba it reduces, it has low dietary calories. Maybe it in a high. Nkokutugambirege buli nutrients ezukiro mubiri okutakuzetaga nugustoring. So the purpose of vegetables is actually to make you satisfied, but have less energy.
Okay.
So it reduces fat. And when we reduce fat, we reduce the risk factor. So vegetables are very important in people.
Okay.
But of course, vegetables that do not have oil.
Okay. So I think Rita baby back replying your question. Then this one is asking Msinguzi Godfrey, active and passive smoking, which is more dangerous?
Passive smoking haliyo omuntu wakuliriza nikimanyisa ngu iyo tokunywa sigara ngabuli baitu no ikara hai omuntu wa kunywa sigara the risk is always the same.
Runginya na utaginya baitu omuli hai.
Exactly. Though watakuginywa who is more safe, baitu most research says the risk is always the same. Baitu passive smoking has a less predisposure to disease. Of course, I take into account no kirora nyowe ni nyankunywa. Most times paka it is you who is taking who will get a lot of disease. These shisha things, I'm sorry to say, it is not good. Even for the people who are neighboring you. You may want to spoil yourself, but you know the people. At least protect the people who are around you.
Yeah, because I remember nkabanda climax Kampala machindi. I had gone with my friends kabene birthday. Bana ngaga oli na nyoshisha na kikuhuhira mtu katika lina bahindi. Na kikuhuhira mnohura actually nkaruganye na zigoliye no mutu.
Exactly.
So no isa na kimuru na kinero smoking.
Baitu passive smoking may not so much predispose you, but I thank him very much kukireta ngu nayo wakubanagena mbikaro mbera abantu bakusmoking you also predispose yourself somehow abokuba you take a small percentage of the active substance in the smoke
abwekika kiri then only but I hear other people saying warrage is important for people with low blood pressure.
It is not true. It is not true to the strongest terms possible. But taking warrage is not bad. I want people to get me right. Kunywa warrage might not be bad. But taking too much warrage is very bad. Okay. You get alcohol has its roles in the body. Hydrolysis and the rest. Fat digestion. But you see, when you take it in excessiveness, then you predispose yourself to what we are talking about.
Okay.
But also, people should know that if I get high blood pressure, then what? Of course, it has a lot of complications. Sahazinu, we have 12.2% of the population of our adults in the country who have stroke. Cerebrovascular accident. Noboli yawe mukiro ramukiza abijukuru olira abaire byenju
no bakobi
in the evening said yawe emotion yebuli ne paralyzed. Why? Because ngokutugambirege because of blood stasis esagame no owe clotinga by any chance kakubaka clot kanwe kapikinge kagenda nako. Because vessel diameter ebinywa byao tekusana. The brain has the most smallest, even the heart by the way. Omutima gwe musupplying ebichweka bindi esagama baitu nagwe nugweha. Exactly, they call them coronary arteries. Those ones that supply the heart because it also needs nutrients. So when this clot by any chance moves from the peripheries ebinywa bya hell, then it comes and reaches a point where it cannot pass. And unluckily, Ruhanga kurugire mungu akanywa kanu nuko kabaire main artery yekinywa ye umutima. You get ischemic heart disease. Go ati ole afunire heart attack. That's how it comes. Ole afunire stroke. Some of you have even survived these strokes by the way. You get transient ischemic attack. You get a warning. God warns you. But you even next time you do the same thing. A transient ischemic attack is a warning. As you know what, TRINAH, any time from today, something like this is going to happen.
Yeah.
Exactly. Why? Because a motoke yekuba negendera muhanda on a high speed. We have one and tomera. Runda muhanda nekoraki. Same thing with blood. Same thing with blood. These things are, it is deeper physiology. Hakaba mpaka mubahuliriza baitu haro omuntu wafunero transient ischemic attack. Yabanza ya sarara, amaiso gafwa, baitu yayongera yakira. But still, they have not yet learned. So these are complications of high blood pressure. Memory loss. Memory loss. Someone gets a very, very good memory loss. You tell them, they forget their name, they forget. You get? Someone gets diabetes. And now that is the easiest complication. When you have high blood pressure, because pressure damages your organs, pancreas, your adrenal system. Pop, you have diabetes type. And now also diabetes, you fail to control it. You put you on injectables. That's it. And unluckily, you find this person is also taking another regimen of probably TB drugs or HIV drugs. It becomes so bad. You get, so your hypertension should be avoided in the closest terms possible, because it is very life-threatening. It can end your life in the shortest time possible. Okay.
Oh, pressure vodom kama tuyambi. So Brenda, perfect yaga passive smoking, it's really bad, because for me, when someone is smoking, I fail to breathe well.
Thank you, Brenda.
Then Brenda still asked, apart from salt, what else causes high blood pressure? We
have talked about that. Honestly, Brenda, if you have been online, there are very many causes of high blood pressure. To have predisposing factors. You people who drink alcohol as if you're hired, it predisposes you to a lot of high blood pressure. Not only that, but also kidney disease.
Okay. So I think topic here, the high blood pressure, to closing your hand. Doctor no sobara kubaho obugamba butaito ngokwa soko ya controlling au bekintu shona, then we jump to another topic.
We vale munaboli topic te hoire. Maybe for today.
For today, yeah.
Because blood pressure is very broad. And because we shall be having this show every Friday, not only with me, but also other health professionals who might be able to come, there are very many things to discuss about high blood pressure. We have not even covered a half. For instance, high blood pressure causes heart failure.
That's true.
Heart failure. We classify it in New York class 1, 2, and 3, and 4. You know, we have not talked about that. People around 10% of our population in the country of the elderly has heart failure. Eka progressing hypertension yagenda mu heart. We are now not managing high blood pressure, we are managing heart. Omutima gukalemererwa, it can no longer work on its own. So what I'm saying is mwebale kutuhuliriza. If tuwabaza ubwiro bukera nibikora impact nyingi, usharinge na mtahi wawe wakubatala active information yenu muhike utomanya, you can change your life. By to topic te hoire. You can keep those questions coming in, we shall always answer. You can reach out to the hospitals. There are very many hospitals around here. You reach out, consult, and surely you will get answers.
Okay. So thank you so much for this topic himself. Katunihira even next time wijo tuegese ne kusinga hao. Omanyire ekigambo obwomezi kintu kyamani. Nkisinga actually ebintu byona omuntu kasito mwegese habwomezi bwenge yasome kubulinda. So kintu kyamani mono. So today we came with two topics to talk about. Tuzire kubazaho high blood pressure, then UTIs. UTIs leka msaba soboreo.
Ito munaboli. Urinary tract infections, rundi UTIs. Anubu burwero kurwara mu ruseke rwaro nkali. Enseke zawe zinkali. Ruhango byalna hango umuntu akamuhereza systems. Systems operate to make you a person. So, but we have cells. Cells form tissues, tissues form structures, structures form organs, and then organs form systems. Naturally, umkazi in a reproductive system. Naturally, you have a respiratory system. System ya respiration in the organs is room. Today we are going to be talking about the genital urinary system. Genital urinary system. Now, genital urinary systems are organiziki. Runda alumu ebichwekaki. ekyokubanza mune kiri common our sexual private organs. The female part, timanyira bwakitubete byensoni. But the female part and the male part, those are organs. But we have structures that help these parts to communicate with each other. Okay, we have the kidneys in Sigozao, for instance. But ekizibu ekindi also ekitwine ngu orientation yetu yomubiri tugimanyira. Nomanya amatu gaba hanu, amaiso gal hanu. But tomanyira Sigozawe zibankaha.
Just no huranzikira.
You know gamba ngo insigo. Actually most people who come to the hospital jana gado kitanyo insigo ziroire. But no sasa anka ni sasa mugongo. Is it true that the kidneys are in the back?
No.
The answer is no. You get umuntu neza na kugambera dokita nyowe ni mpuri enda ne sasa. Enda ne kusasa ranka. Is this the stomach?
Yes,
no. Exactly. So the stomach is always in your epigastrum. Maybe next time to have no weed to kuja to call orientation ya anatomy. Such that you can learn to locate your pain. Obora huro sas in the lower abdomen. That is not your stomach. You get? So parts za genital urinary system zinu eyokubanza munu organ eyokubanza is the kidneys. Organ ya kabiri okuwaruga kidneys, because the kidneys are on the left and the right side, and we call this the lumbar region. The left and the right lumbar region. That is where we find the renal angles. And they are retroperitoneal, but that is a lot of anatomy. But kidneys have what we call ureters. Ureters nuwo buseke okuruga hansi gozawe bukagena mu ruhago rwawe kali. Omugaso gw'ensigo zawe is to form urine. But also it is to remove substances that are not useful to the body, and also have and also have what we call electrolyte balance. Omubiri gwawe electrolytes zagwe kubalancing, rundi ebisura byawo kubalancing sodium, potassium, chloride, but also your nutrients like glucose. Okay? So ureters zinu enkali emazire kuba formed gusteka mu ruhago rwawe enkali. Uruhago rwawe enkali nurwahule enkali yawe until sensation yogenda kusese kozereki. Ejo nayo trigger ero physiological obongo bwa mugamba wewe. Uruhago rwijura gendo koleki gendo sese. Those are feedback mechanisms. We shall not talk about that. But also the urinary bladder has another tube called the urethra. Urethra ni henkali yawe mu ruhago rwawe rwenkali then obsessa here. In men it is over 25 centimeters, but in women it is very short, around 5 to 7 centimeters. Urethra. But zino organs ezindi ziri munda tukuzirora. For you only see the outward. But when we say genital urinary system, we also include the reproductive system. This starts from the fallopian tubes in women to the ovaries, so to the uterus, inenda, then to the cervix, and then to the vagina. This is what we call the genital urinary system. But in men, it comes from the prostate gland. The glands called murtoro glands is forming of stobwao. The second semen vesicular tubules in the stobwao kwa hurwa. Nukwe kaija atemi okukozesa bukarugai. Exactly. So system wenu ntujeta genital urinary system. Maybe next time we shall come with charts. And we demonstrate these things off paper. Exactly. We shall come with these things off paper. But to obwiro kukira system wenu eroire muno, because partly we are not sure of what is happening, but secondly because we are too negligent to know that it is happening. So urinary system wenu genital urinary system neka muno kurwara uburwaire buli combined tukweta PID, But to takagira pelvic inflammatory disease, I want us to first talk about UTIs. Out of the population, you find 80% of the females have UTI, which is either poorly treated or it is not treated at all. Some people even think they are bewitched by their ex-husbands or ex-wives. Because, you know, when this system is disturbed, people are not settled. Someone thinks, now, I have been having very good manpower, you know, but now my penis even does not erect. I go for 3 seconds. What is happening? This is witchcraft. You get? It is because the system actually has a problem. Symptoms are urinary tract infections. Mubasaija in men, urinary urgency and frequency. Kwikara noenda kusesa sesa.
No urenkali ne kuruma noendo gendo na.
No kubetaka kurumiri noendo kale no sesa every time. 30 minutes past, you are going back. Second minutes, the 30 minutes, you are going back. What is happening? Over time, you get it? Then another time, you start feeling lower abdominal pain in the hypogastrum. Then another time, now you start feeling back pain.
Aima kitwara wire kikurora ngu omusaija no mojo yafuna symptoms zeze za UTI.
Eko nakintu jakeka. But to want kyabazaho symptoms you might be having a UTI. Obwiro bukire nkali okusesa ne very cloud. No sese nkali ro hekiforo kikoto mun. Then nkali okusesa nayo ne changing kali. Obwiro bukira boko rusekerwa ruenkali rumwe bihoya. No sese nkali rumwe sagama. No sese nkali rumwe amasera. Sometimes you even start passing. Discharge. So binu biona nibija haba UTIs. But obwiro bukira kakuba if you get a problem with your prostate because it is also a urinary organ, then you also get back pain. Mtu nakambera ningenda Kongo nungusasa. Nimera pain kila tizukukora. But over time, these bacteria actually cross and they reach your bloodstream. Hatunurua rumsuija, malaria, chills, rigors, fibromyalgia, you be there and you feel malaria. They check malaria, negative. RDT, negative. You know we are in an endemic area in that every fever you feel, you have to think of malaria. But these UTIs can actually... Exactly. Obuhuka bunu, nibutemba niburuga mukasura kawe, nibugenda mu rusekero wawe ruenkali, nibugenda mu ruhago rwawe ruenkali, nibugenda mu nsigo zawe, musigo mburuga mbugenda musagama yawe. You go in the systemic circulation, so you get acute bacteremia. No funa bacteria musagama yawe tesemerire kubamu. Kakuba bacteria ehika musagama yawe. Immunity, body defense system ne kwala tingira umuhatu weo
hura wabana weak
watahirirwa. Because naturally we have a defense system of white blood cells, macrophages, neutrophils, and eosinophils. These ones are responsible for marking disease causing microorganisms and eliminating them as fast as they can. But in the due process, you get fever because of inflammation, cardinal signs of inflammation, fever, pain, redness, headache. So UTIs, egyo tractate warabamu tugeta ascending UTIs. Baitu no sobora kufuna descending UTI. Toyeterene na muntu tokozereki, you are not exposed, but you had had cough, a serious episode of cough. So ukubano ukora obuhukabuli obwa cough can also cause UTIs. It is very common. It is very, very common. Some of the microorganisms that cause upper respiratory infections, not only cough, but upper respiratory infections. they can cross and they reach your bloodstream. And of course, you know, blood, it is a must, it reaches the kidneys.
Yeah.
So when it reaches the kidneys, these ones pass through the glomerular filtrate, they are filtrated, then they go in your urine. So when they go in your urine, of course they will go to the urinary blood. So from the urinary bladder to the urethra, you also have a UTI. That is called a descending urinary tract. But on ascending, this one is the most common. Ascending. In that, for you know hanu anogena no sharing ebisesero n'abantu abarwaire bwa UTI.
Yeah.
Aha, then you get the UTI. That is one way. But of course, commonly, it is sexually transmitted. You have sex with multiple partners, which is unprotected. But also someone you are having sex is having sex with other people also. So it is a triad. Now we have already gone to the causes of UTI, but I was explaining how does UTI come about. So I don't know whether you have any other question you want to attach to that.
So halo kusanga abantu doctor most obwire kabwatkwata. So kukira muno mu bakazi mbeire actually ninkaguza bwire kiyabo omusaija kujja kuraya manya ngati nyine UTI habo kuba mbakazi imanya ho nchi yangu habo kwano uneja kura rundi wasuna wito omusaija kitwara obwire naguma nacho. Very
true. Habo kuba abasaija hebo urinary tract yabo urethra nkoto. Urethra yabo urusekerwabo rurehiraho and orwanyu rugufu. So yours, it is always easy to identify symptoms. But what causes this UTI should be the question. What causes this UTI should be the question. The first answer is sex, unprotected sex. You go to John, you have sex. In the evening, you go to David, you also have sex. But David also saw Anna in the morning, and you know, stuff like that. So that one predisposes you to urinary tract infections. Birth control pills, they predispose you to UTIs. You didn't know about that? Then you should know about it. They predispose you to UTIs. Kidney stones in men. You know, when urine stays for long, it solidifies. So amabala ganunga blocking path yankaliambere kurawa. So yankali nesigara inejunda reto obuhuka obwa UTIs. Diabetes. Amantu abakurwara sukali. Obwiro obukiro bwokubanurwara sukali, it is always impossible for you to stop suffering from UTIs.
Kama umamba sesa 24/7.
No ikara no sesa ngari yerum sugars. And these microorganisms also feed on sugars. Toilet habits. How do you clean yourself after using the toilet? Most of female UTIs, if they have not come from the hygiene, it always comes from your anal opening. Because it is very close, it is actually less than 5 centimeters. So it means if you don't actually clean yourself very well down there, it is most likely that E. coli, the commonest cause of UTIs by the way currently, Bacteria Bageta Escherichia coli, enterotoxigenic, enterohemorrhagic E. coli, UTIs because of that. When you're cleaning yourself, you clean yourself towards the vagina side instead of away from the vagina. So you most times you make these organs come directly to your vaginal tract. Exactly. These are feminine products that you use to feel feminine. V-wash. I hear wash. I'm not thinking of the marketing, but you know, naturally, mubukazi bwawe. Ruli museja bwawe.
Ziti shana habo gentle.
Exactly. Haba your normal flora. Normal flora nubo buko bukarayo bulinzire. They maintain good pH. They maintain good smell, such that you don't smell, and they make sure that your vagina is at a certain humid temperature. You get it? So it controls other microorganisms that are coming there from actually infecting these ones. Do you know what happens when you use these feminine products? It actually makes these same organisms cause infection.
Oh.
Because they change the nature. So normal bacteria yakuberiyo okozesa products zinu pH nehinduka because these bacteria work under certain pH and temperature. So nehinduka kumara kuhinduka obuhuka bwenyine okuwa buliyo n'okongera bukaleta infection. Using soap to wash down there, you will always have UTIs for all the years of your life because you don't have normal flora.
So hati ingerike yosobora kwe cleaninga mukurangu nkomano wisiki wayera kurungi abuko bakatuletereze nagasha na habagento wajibiki kugamba ngo miska cleaning kurangu abakol
hati tutakahikiruko twa tushali ontu bazao causes za UTIs. Urinary tract infections nizija kakuba immunity yawe bancheke. Immunity yawe nebera ncheke nka obukuba noja genda menses zao cervix ne openinga nikiba nikimanyisa. Anyway, this might not be UTIs. These are pelvic inflammatory infections. But of course hata obukuba no bazao UTIs PID paka nazo nizikoraki abukuba all these organs are in your pelvis. So before we go that side Kale, let me first not go that side. Kakuba basurukale babo mubiri baba hansi. You lose ability to defend yourself against infection. This happens when you're taking chemotherapy. Let's say no mbazi ya cancer, you always have UTIs. Mbazi ya tuberculosis, you always have UTIs. When you are HIV positive and you are immunosuppressed, tokumera mubazi gwao bulikiro, you predispose yourself to UTIs. So they come as a result of immune. But most times when you're going for your menses, or we don't kira, your immunity is low, but even your cervical closure is always open, so you're predisposed to urinary tract infections. Now these ones come in a wide range. It can be candidiasis. You know, there are those people who are always itchy down there. Then there are people who have a discharge, even if she does what the discharge does not stop. But you too, there is always a natural means of healing. Before we even go pharmacological, utakagira hamevazi ya wajungu, utakagire nka, there is always a pharmacological way of healing. So, tuagaruka chikaguzo kiao kiwe nkigamba.
How can you prevent? Even this one has asked Brenda Yagamba, how can UTI be prevented?
So preventative mechanisms is on to jakuzigiao. Cause when you're having sex, some certain sexual positions predispose you to urinary tract infections. For instance, you are having anal sex. Funny to say, it doesn't make sense. You know, you are having anal sex, but there is also a vaginal opening. So you have sex both in the anus and in the vagina. You know, that is how mad this generation has gone. And exactly, may not even be that.
I think
someone someone puts his mouth in the vaginal opening of a woman. That is sexual pleasure. You know, most times it doesn't make sense. So after 3-4 days, they have oral thrush, oral candidiasis. You know, it doesn't make sense most times. We predispose ourselves to these infections. You get, you are having sex, then by mistake the coitus, then it goes in the anal opening, then again you come back in the vaginal opening. You transfer microorganisms, over 1 million of E. coli from the anal opening to the vagina. So you are giving this one a very serious UTI, which might be which might be hard to treat, by the way. And you know, for this bacteria, immediately it reaches inoculum size. Pop, active disease. You get? So these ones, how do you find someone is there? After 2 weeks, she has taken treatment. After 2 weeks, itching. After 1 month, itching. So how do we actually prevent these UTIs? Because we are going on a high speed, but probably we shall have another time when we are discussing PIDs.
We have a doctor, we have so I think so kumalira. No basibira ntandake abantu abo. On Friday ntugaruka still in topic mpaka twinege malira.
Obwira obukukira treating urinary tract infections is more preventative than pharmacological. You will take these drugs and actually finish them from the pharmacy. But immediately you go for your menses, you bleed 20 times. You are always putting on a pad month in, month out. You will never survive UTIs. You will never. You have multiple sexual partners. 1, 2, 3, 4, all of them unprotected sex. You will never stop suffering from these UTIs. You get, and you know, if you don't remove these predisposing, you are always putting on clothes that are extremely tight. And deep in there you are putting on, I'm sorry, I'm talking only about females because UTIs are more common in females.
Yeah, that's
maybe
true.
Next time to Jakuaza sage. But you are always putting on knickers that have nylon instead of cotton, meaning they cannot absorb the moisture that comes there. You are always using these feminine products. You are killing normal flora down there, but you're taking medicine for UTI. It will heal for 2 weeks. After 2 weeks, the UTI will come back. You get, so kakuwa zin predisposing factors utaziao. You are always sharing urinals everywhere you go. Urinals. You get, you will never stop suffering from UTIs. So abahuliriza wetu abarungi habugwire maybe ntujya kusaba management etongezeho habokuba this is more vital through you. Ningonza kubasima abokutuhuliriza inywe nababere online nabandi ntujya kufuna obwire ebintu bino tukiranuleho kukiraho abaitu tugonza kusima muno management ya Fort TV habokutuhereza omugisa guno akujaga kusharinga information ya nainywe every Friday kutuyamba nenyo kubayamba kwetegereza obumezi bwitu nkokubuli. Until next time, amabaragange manyeta Mutegeki Frederick Innocent Adieri mukama abalinde.
Amina. Doctor wasoko bamende namba zao ubundi the other time abandi batazifuna ubundi abandi bakabatalo so kubahe namba.
Namba yange yesimu ya MTN 07799 57259. Email address yange fredino13@gmail.com. Twitter handle yange @fredino. Ningera ni biebi.
Okay, thank you so much, Dr. Frederick, webale kustwara mkicheka kine cy'obumezi omanyo obumezi kintu kikuru. Kandi hire bambi abali aherwa kumuhuliriza kandi muhire mwayega. Abokuba so kusanga omuntu nayegesa baitabandi babuke baituni manya abange mpaka our viewers mpaka begere according to the messages they are saying. Tali ba Juliet Namara, Brenda Perfect, Godfrey na abandi nywe na abaloho bambi mwebale kutusagika mwebale kutugonza mwebale gonza for TV no kusagikaga program zaitu zino obtosa. Brenda Perfect agambire ngu thank you doctor once again I have learned a lot today. Webale bambi ukubahoga no kutusupportinga no kutugonza naito ntubagonza muno hamuli yoku. Thank you so much. Let me wish you a good day for today and today is a Friday. Kamba gondeze na weekend enungi. Enjoy responsibly.
Amen.
Bye.